Hi everyone, I am Dr. Shikha Garg. Today we are going to discuss something about arthritis. As you all know, there is multiple type of arthritis, rheumatoid arthritis, osteoarthritis, or there could be gout. So apart from the joint pain, there are other symptoms like swelling, stiffness, reduced range of motion of your joints. There could be redness or warmth around the joint. There could be fatigue, weakness, persistent fever, or there could be numbness like sunpana or tingling in the hands or feet, that is kidiya katna kind of. These are all symptoms can be indication towards any kind of arthritis. To get it checked, you need to get in for the lab test to confirm if you have any kind of arthritis. So in the next we'll discuss about what are the risk factors which lead to arthritis. So we were discussing about the risk factors which can lead to arthritis. So there are two kind of modifiable and unmodifiable. In the modifiable, the first risk factor is being obese or overweight. Second could be the infections. The infections leading to arthritis would be painful, severe swelling, everything would be there. Another risk factor is the joint injuries. If you had any injuries in the past, there is a high tendency to get arthritis. Another factor is the smoking. It's a modifiable factor, right? But smoking can really deteriorate the joints. So there are certain non-modifiable risk factors like age. With increasing age, you are bound to or you tend to have more of joint pain, swellings, everything. So it can lead to arthritis. Another non-modifiable is the gender. Females tend to have more of arthritis. And another factor is the genetics. So if you have certain autoimmune, HLA, SLE, all those things, there is a high tendency. So now we are going to discuss joint pain. For the joint pains, if you have a history of fever or a small history of joint pain, like few days, then you need to get tested for your dengue or chikungunya or malaria, or there could be septic arthritis due to infections. For that, you need to get tested for all this along with CBC. If you have a chronic history like a few months or probably a long time, there would be redness, swelling, or pain in the joint, chronic pain, then you need to rule out your rheumatoid arthritis. For that, RA levels, anti-CCP levels. For your gout, uric acid levels. There could be so many types of arthritis are there: psoriatic arthritis, juvenile arthritis. Depending upon the disease, you need to get tested. Common test along with that are the CRP levels, ESR levels, and CBC levels. These are compulsory. Gout or arthritis, it's a form of arthritis. So it is usually caused by uric acid crystals. When uric acid is excess in the body, either it is not excreted through the kidneys or the production of uric acid has increased. Both of these will cause crystals to deposit in the joints. And then joint would have tenderness, which is haath laga ke pain. There would be redness, swollen joints, and there would be problem in the motility. And most common joints affected is the big toe, पैर का, foot का, great toe, and it would have a severe pain or severe swelling, severe symptoms all of a sudden, usually at nights. So gout can present as an attacks of pain. The main causes and risk factors we'll discuss in the next one. For further details, subscribe to our channel. So uric acid levels more than 6 in females and more than 7 in males is considered to be higher, and it can lead to deposition of the crystals. So what are the risk factors? First is the diet containing high red meat, diet containing fructose in terms of artificial drinks, juices, all those things, alcohol, beer, these can all lead to deposition of the uric acid or increase in the body. Another is the overweight. So weight management is very important. Another are the medical conditions, chronic medical conditions like diabetes, like hypertension, like heart disease or metabolic disease, and of course the obesity. And certain medications if you are on, like ACE inhibitors, beta blockers, all these can cause high uric acid. Or if you have a family history of gout, that is again another risk factor for the gout, or you have a more tendency to get it. So we are discussing about gout. So men can have gout at the age of like 30 to 50, and in females it usually develops after menopause. Of course, anybody can have gout at any time, but it's the more tendency towards it. And if you had any recent surgery or trauma, it again has a tendency to develop any kind of arthritis. So what would be the complications if you have gout? First is it's a recurrent thing. It will happen again and again. So diet modification, exercise, weight management, all these are very, very important. Apart from that, if you don't treat it, it can lead to advanced gout, which will be like urate crystals. They are formed under the skin, or they can deposit at the various sides of the body, and specifically in the heel area called Achilles tendinitis. And it can also lead to kidney stones, which will of course be a painful condition. So we are discussing about gout. So we have discussed what are the symptoms, how do we, what are the risk factors, what are the complications, how do we treat it. But the main thing, how to get it diagnosed. So you need a simple blood test. Fasting, non-fasting, there's no complication or any inhibition with that. Anytime you can get your blood checked, a small amount of blood is drawn and a uric acid test is conducted on it, and the levels which come as per the procedure done, there is a certain normal reference range. So if you have more than that, specifically females more than 6 and in males more than 7, is taken as high uric acid, or uric acid symptoms can develop. There are patients who might not develop symptoms even if they have higher uric acid levels. So in those cases only the modifications are needed and further frequent checking is needed. And if those have symptoms, of course the treatment options are available. Hi everyone, I'm Dr. Shikha Garg. So we are discussing about the gout or uric acid arthritis. So what would be the treatment option? First is to cut down on your diet, which includes lot of proteins or purines basically. So red meat, alcohol, spinach, all the lentils, pulses, all has to be reduced. Second is to start exercising. It is needed. Another is the medications. First is to reduce the inflammation, so anti-inflammatory, and also certain medications which will increase the removal of uric acid from your body, or it will reduce, there are other types which will reduce the production of uric acid. So two type of medications are available. So you have to consult your doctor so that they can recommend you the appropriate medication as per your uric acid levels and as per your symptoms. So today we'll discuss heel pain, or it is also called plantar fasciitis. So what exactly is heel pain? When you wake up in the morning, early morning, there's a severe sharp pain in the heel. So there are certain symptoms you need to keep check on. If there is pain and stiffness under your feet, or it strikes early in the morning, or if it intensifies on standing or walking, or if your feet feels like tight or like tense, and there is a swelling on the underside of the feet. All these are the common conditions which can tell you there is inflammation and pain, and it's a plantar fasciitis. So what could be the risk factors? So we'll discuss risk factors and what tests to be done and what else treatment options are available for plantar fasciitis. So we are discussing plantar fasciitis or pain in the heel. So we discussed what were the symptoms. Now we'll see who people are at more risk. So if you're overweight, that is one of the major risk factors. Apart from that, if you're not wearing proper shoes, proper arch support, then can cause pain in the heel, or plantar fasciitis can happen. Or if you have a very active job, that means if you're standing for too long. Another is the structural deformity. If you already had flat foot, that can be a one of the reasons. Apart from that, if you're a runner, long distance runner or a sprint runner, and if you're like into dancing, into activities which are putting a lot of pressure, acute pressure on the feet. Apart from that, there are certain disease which can cause, if there is a deposition of uric acid or there is a deposition of calcium at times, these can also cause severe pain. So what tests do we need? So we are discussing fasciitis or pain in the heel. So we have discussed the risk factors, we have discussed the symptoms. Now if you have, you need to check for your lifestyle if you have any conditions due to that, or otherwise you can get tested for your uric acid, or if you have gout, or if there might be a hypercalcemia in certain cases, or majorly you can go in for your stretching exercises. And if it is a very chronic pain, you can go in for your x-rays and you can visit your orthopedician. Initially go in for your blood testing. You might need x-ray also later on if it is very chronic and very painful, but initially lifestyle changes, specifically looking at all the risk factors and removing them, would help, right? Thank you. So we are going to discuss weight management today. So there are many faceted thing weight management. So it's nutrition, it's exercise, it's your diet, it's your sleep schedule, your mental health, along with that your physical health also. So when you start to get into the fact that you have to manage your weight properly, you have to see all the things. So you can always start with your basic physical health first. Get your basic tests like CBC, thyroid, lipid, LFT, RFT, vitamins done. And if you have any family history, so according to that all the customized tests should be done. If those are normal or those are okay, so then you have to focus on other things. Why is it? If there are deficiencies, of course go in for the supplements. Exercise, sleep schedule is very important, and mental health well-being is extremely important. We were discussing about the weight management. So first part was the personalized medical assessment. It's very important that you get tested for your basic health care. Second is to go in for the safe and effective weight loss ways. Of course you have to see your dietitian, of course you have to see your doctor for all the effective ways to lose weight. Don't go in for the crash diets or the keto diets without under supervision. Another is the customized treatment plan. If you have diseases which can lead to weight gain like hypothyroidism, PCOS, all the or hormonal imbalances, you need a customized proper treatment plan. Another is the nutritional guidance. For that dietitian will help. And of course it should be considered as a holistic approach. Weight management is never a single thing unless until you have an